12:30 here. Thanks everybody for joining. And we'll have a few more people probably rolling in here after a few minutes. But today's topic for Secure Video webinar is provider burnout, and obviously a hot topic across healthcare. And we want to go through, what is provider burnout, and some ways that Secure Video is helping reduce that with our customers. I'm Josh Hood, account executive here. I work with our existing customers, and I have alongside me Kate Brandis. She's our VP of operations.
Hey, everybody. Thanks for joining today.
So like I mentioned, what we'll cover, first of all, most of you probably know just overall what is provider burnout, some of the top causes of provider burnout that we've been seeing across the healthcare industry. What needs to change? Obviously, Secure Video can't change everything, but there are some things that we're seeing, and we can help our customers with that with this issue. So we'll go through a lot of those, how Secure Video can help. We'll also walk through some real customer stories that we're actively engaged with right now, and then at the end, we'll leave time for questions. But as we go along, if you want to chat in questions, we'll have Michelle here to help us out, answer some as we go along. All right, so just to start, what is provider burnout? Really, this is a long-term stress reaction. It's physically, honestly, physically harmful for healthcare professionals. There, really a lot of symptoms of emotional exhaustion, this detachment from patients, no longer really caring about the patient because they're having this issue. So symptoms of fatigue, headaches, a lot of other physical ailments that we're seeing. Based on some research, over half of healthcare providers have already experienced this, and that number is increasing as we go along. And just across the healthcare landscape, we found that ER departments have the highest burnout rate. So the top causes of burnout, provider burnout, one, EHRs, really the admin tasks that providers are having to do. Really these days, on average, EHR documentation adds roughly 9 hours weekly on top of patient care. So it's a lot more busy work for providers, not really being able to focus as much on the patient. The work-life balance, as being a healthcare professional, this is a huge topic. And we found that in the hospital system, over 40% of employees there are considering switching to a private practice. And this is really motivated by that work-life balance and getting more time back to spend with family and friends. A couple other top causes: lack of internal relationships within the organization or the clinic or hospital, hazardous conditions, obviously the ER being a big one there, and then overall just growing patient demand, just a lot more patients to handle, fewer providers to be able to handle them. And again, with the ER department and some other urgent care type situations, the providers are being put in very emotional and stressful situations. So it's a big burden on them a lot of times. So what we've kind of looked at, and what we've been hearing from, talking with people in healthcare, what needs to really change. The first thing, that's software usability improvements. So improvements to EHRs to make it just more user-friendly overall. Having the providers be able to, finish those tasks quicker, potentially some automation there. And this would allow really to have them return to a patient-centric approach. Also, along with that, EHRs, system interoperability. So being able to have systems integrate with each other, talk to each other, where they're not having to log in of multiple systems and log certain things across, several different software products. Overall internal support via the clinic, the hospital, admins, somebody there to talk to really if they're going through issues. We think that can improve. And then really the last two go hand in hand: workload adjustments. So having appropriate staffing, I think overall helps providers really maintain their sanity, and not having them work a ton of hours with a ton of patients and kind of spread that across the landscape. So how Secure Video can help. the first thing really at Secure Video, our software platform is very easy to use. As you know, the people on the call today that are our customers, um, very simple, straightforward user interface. The dashboard where you can schedule a session very quickly, easily. You really don't need to be tech savvy to schedule a session and hold sessions. We have automatic invites and reminders, so really to help alleviate some of that managing your schedule, where our software is taking taking that over for you. Configurable options. So as far as like notifications, how much you want to be notified, how little you want to be notified of sessions or cancellations, you can really customize that how you want. So you're not getting your inbox or your phone flooded with invites and reminders. Simplified e-document submission. So some of you may use our e-documents today. If not, I encourage you to take a look at it. This now includes image capture as well. So instead of logging into another system and having to send a document or having something on paper where your patient has to send in, they can all do that through our platform. So you can build out your own e-document. A lot of times these are consent forms, maybe some insurance information, things like that. Patients can now do that through the Secure Video platform, and they can also now include images, so things like driver's license, insurance cards, if you need to have those for your patients. And then maybe another thing you might not be aware of, our communication tools embedded in our platform. We have a simple chat feature that allows you to chat with your patients. You can also send files securely through that function. So that another way just to help you communicate with your patients more easily.
Josh, before you go forward, I'll just add, there's a question in the Q&A. And please, for anyone that's on the call, please feel welcome to use that and send questions as we go along. Do my patients need to be on a computer, or can they use their phone to send images? And this is a great question. The image capture feature is really new for Secure Video. So we're really proud that this is now something that's available to our customers. The main use case that we've heard, as Josh mentioned, is they need a way for patients to upload their photo ID or their medical insurance card. I'm sure there are other use cases for it too. But just to answer the question at hand, patients can be either on a computer or their phone to send images. They simply attach an image just the same way they would, to an outgoing email. So they would just select the image file given the prompt that's in the e-document. But it's a very simple submission. And then once they submit, they can make changes to it or remove it from there.
Perfect. Thanks, Kate.
Mm-hmm.
So moving along, another way we really help with, minimizing burnout is our 24/7 support. So we want the providers really to focus on that virtual session with the patient. We don't want them focusing on all the technical aspects of, I'm having this issue logging in, things like that. Our support team is there to help. We support providers, but we also support patients. So a lot of times our customers' patients are reaching out to us for help, and that provider may never know that they've reached out, and we've got them connected to their session. We're able to help them. This is available via phone, email, chat, and it's all US-based live agents that patients and providers have access to. And honestly, these are people who, like us on the phone, call right now. We really care. We want to have the provider and patient have the best experience possible. So as I mentioned, this really just helps providers stay focused on treating their patients, not really focused on the technical side. Another feature, not a lot of our customers use, but can be very helpful for providers and patients, is patient self-scheduling. So this allows a provider to have a booking page. So it's basically a custom URL that a patient could go online, basically find availability based on that provider's appointment slots and select to request a session online without ever having to call the provider, go to their website, anything like that. There is on-demand available as well. Right now, what I'm showing is the top picture there. That's what a patient would see if they're booking, trying to book a scheduled session. So the provider would have their availability listed. They could select up to 3 sessions that they'd like to schedule. And then that'll get sent. The second picture there is customizable, but there's a couple of things they can have, the patient fill out first before submitting the request. And then the third picture there at the bottom would be on the dashboard of the provider. And that provider has the ability to accept the session where it automatically gets scheduled, or decline the session and give a reason behind that. Also, this is helpful. A helpful piece of this is calendar integration. So this integrates with Google and Outlook, so easily for the provider to basically show his availability if it's integrated with his calendar that he or she is using every day. All right, I'm gonna kick it over to Kate here to talk about a couple more features here.
Yeah, it's a great piggyback on what Josh was talking about with the patient scheduling. The virtual clinic on demand uses sort of a similar model. The virtual clinic is really more an on-demand request. So it's a either a device or a public URL where someone is requesting sessions right now. So they want to see first available provider. This works really well in an urgent care or ER department setting. So imagine, as Josh was talking about, some of the healthcare providers that are most impacted by burnout, this is a tool that can be used to help alleviate some of that workflow and process. So in the screenshot that's shown here in the example, this is just a tablet. Imagine this is a tablet that's in an emergency department. And then you'll see there's the opportunity for them to request a session now from either an ortho, psych, or just a trauma unit consult. So just by clicking request session now, that session goes to, similarly like in the previous slide, goes to a group of providers who are positioned to accept these requests, and they can join a session right away. So if you have in a situation where providers are serving, multiple locations in a large hospital system, if they're a specialty provider and they're doing so, or if they're in a remote location, they can still support quite a few patients or quite a few emergency departments in one, just using this tool. So hopefully this is, a tool that can be used to help alleviate, especially as Josh was talking about, some of the staffing concerns. All right, the next one we'll talk about is interpretation services. And this one is truly going to the core of some of those frustrations that I know providers may have if they can't properly communicate with patients. And as we know, access to healthcare is so important for so many, regardless of whether English is your primary language. So we've built in the capability for on-demand live interpretation services into Secure Video. Now, if you're already an account holder with us and you don't see this interface, send an email to support, get in touch with us. We'd love to be able to enable this feature for you if you're interested. So what this does is allows you to click the Call Interpreter Now button that there's an arrow pointing to in the top left image. That will bring up a menu that shows about 240 languages that you can choose from, including American Sign Language. That sends a call to our interpretation service. We use a third-party service for that called Voice, that then connects you with a live interpreter in that language. So allowing for this just makes it a really straightforward process. Usually they have a language interpreter join within just a couple of minutes. So you'd be able to have a much more effective and thorough conversation with the patient. It does mention here the simple per minute utility billing. I bring that up because as you're setting this up with our support team, it's really just we bill it based on how much is used. So it's per minute billing, $1.25 per minute is the rate we have. So you select a language, start using it, and then that automatically just calculates onto your Secure Video invoice each month. All right, next slide. The next feature we bring up related to burnout is mass calling. Mass calling is a feature that allows you to make outgoing calls through the Secure Video platform through your dashboard. So if you're already connecting to video conferencing services through Secure Video, you can do the same thing via a phone call. So, again, we talk about provider burnout in terms of providers needing a bit more flexibility, a bit better, work-life balance. Sometimes that includes providers working from different locations, and Secure Video is accessible anywhere. It's a cloud-based application that's available right through your browser. So if you are taking appointments from home or meeting with patients virtually, mass calling also gives you the capability to call them. So placing a mass call allows you to set up a verified phone number through the platform, and that number is what's going to be displayed on your patient's caller ID when you call. So it could be that you have the verified phone number as your office line, and that's what appears to the patient. And what this does is allows you to even use your mobile device a tablet, laptop. As long as there's speakers and a microphone, you can place that outbound call. It's a voice over IP call. So again, this is a sort of utilization build extra feature in Secure Video. If you don't see this feature enabled, let support know, and we'll absolutely work with you to get it set up. Okay, the next one is really, to me, the kind of gold standard when we talk about ways that Secure Video can help alleviate burnout. It's integration with EHRs. So, all healthcare practices use an EHR pretty much nowadays, or some kind of practice management software. All of them have different capabilities. And so what we try to offer is sort of the chameleon approach, where we can offer two different ways of integrating with EHRs, our practice management systems. That's probably something to contact us, and we have a separate conversation about it. But the first way is sort of the quick and easy way is the integration with HL7 messages. So what that can do is allow for automated scheduling, where if you schedule a session in your EHR, that session automatically is created on your Secure Video dashboard. So it's just one less step that you have to take. And again, the whole goal of today is to talk about ways to reduce clicks, reduce steps that you have to take in the administrative process. This is definitely one of those things to look at. The other way is to look at an API integration, and this allows for a bit more of a sophisticated approach, a bit more modern approach to your integration, not only allowing for that scheduling integration piece, but allowing for things like user management. So if you're in a large organization and you have users that are all set up in your EHR, then those can be managed through an integration to mirror what's in Secure Video. And also the e-document capabilities for integration exist through an API integration. And this would allow you to do things like collect data from your patients on an e-document when they fill out their forms for their visit, and then have that data map over to the EHR and update existing fields that are in the EHR. So those kind of synchronizations, Josh was talking earlier about interoperability. This is something that's really important to that whole mindset. So that's just one of the things that can be accomplished through API. And then finally, session history, where you're pulling in, not only all this data we've mentioned before, user management, scheduling, but now you've got real data on session history, who attended the session, who didn't, duration, things like that, that a lot of people probably need for, sort of insurance verification, billing, things like that. All right, continuing on, we did want to talk about just a few real customer stories and situations that we've come across in working with our customers today that are related to provider burnout and ways that we've helped alleviate it. Some of these things we've talked about and telling you about some of these features, and we just wanted to give you some examples of how real world customers are really using these features. So the first one I'll talk about is a large healthcare system that we work with. They're in a large city with about 4 different locations for their hospital. They, a couple of years ago, started the process of setting up a scheduling integration with Oracle. And the whole idea behind this, we work very closely with their IS team, who is really driven to make life easier for their staff. That's sort of their whole MO. So the scheduling integration was really critical for them. It, again, just reduces the need for additional steps to be taken in both the EHR and in Secure Video. So in doing that, we were able to set up the integration. And now when they schedule in Oracle, session is already created. Now we're further along in that process with them, working on some different phases of how an integration can be even more advanced with them. And one of the things we've recently accomplished is to set up a place where they can launch the Secure Video session right from within the EHR. So it just, again, makes it easier for providers to navigate if they have a lot of different systems or things that they're trying to keep up with. All right, I'll toss it to Josh for the next one.
Yeah, and the next one we're currently working with came to us about a year ago, I think. Is a mental health clinic. So they deal a lot with substance abuse. They hold large group sessions on our platform, and they really wanted to make it easier for obviously their patients, but they have a big emphasis on their providers as well. So I think this is a good call out to provider burnout and how that they try to reduce that. They were able to set up what we talked a little bit earlier about, the virtual clinic. So they allowed their patients to go schedule sessions online via the virtual clinic, via our platform, and providers aren't having to manually do all that process. The providers also are something we haven't talked about yet. We have a change host feature in our platform, And this mental health clinic utilizes this feature heavily. It allows their providers to have more flexibility in their day. If they're sick, if they're going to be out and they have a group session scheduled, they don't have to cancel that. They can actually change that session over to a different host, a different provider within the org. So they have roughly 15 providers across multiple locations, and like I mentioned, they're really keen on allowing that flexibility within their staff. It's also back to you, Kate.
Yeah, the next one is actually a more recent customer that we've started working with. It's a county health department in the Midwest. We have been in the process of implementing their service earlier on in the year. One of the big needs that they expressed to us is the need for interpretation services. And that's because they are in a county that happens to have a large refugee population where English is not their first language. And at a county health department, they see all kinds of patients that come in, may not have any English speaking capabilities. So the ability to have interpretation services built into the platform was really critical for them. And especially the fact that it accommodates some of the less common languages. In their case, that was very interesting to them. And the other thing to point out here is that sometimes it's not just about having a telehealth session and having a live interpreter join the session. Sometimes you have a patient physically in front of you, and the ability to use our platform just to create that on-demand engagement when it's needed was a really useful tool and point for them.
Sorry, get off mute there. And then the last one, this is a hospital system we've been working with for several years now, and their focus that we've helped them with is in their ER department. So we've talked about the virtual clinic for on-demand sessions earlier. They use our virtual clinic solution for on-demand via iPads, and these iPads are located across multiple floors in the hospital. And this really allows those specialty providers, so telestroke, oncology, it allows them to be in one location, but also being able to help at a different hospital on a different floor, bringing them on virtually where they're not having to go back and forth between hospitals, or they're not having to hire multiple of these specialty providers across the hospitals. So we've been working with them for several years, and they've grown with us as they've developed other use cases for our product. Now on that, I'll open it up to questions. Also, just wanted to call out, as Kate mentioned, if any of these features are appealing to you, feel free to reach out to support@SecureVideo.com or directly to me, jhood@SecureVideo.com. But we'll go ahead and
Thanks.
look at the
And
question
while
board
some
here.
questions are coming in, I'll just add, I know the goal today was to talk about provider burnout, which is a really kind of hot button issue in the medical industry. I think our goal today was to give you some ideas. If you have a Secure Video account and are not thinking of ways that maybe your workflows could be a little easier, we'd be happy to work with you to talk through anything that you've seen today. And two, if you're not a customer and just considering Secure Video for the first time, or just educating yourself on what our capabilities are, again, let us work with you. We'd love to learn more about what your use case is and perhaps how we might be a good fit and help you alleviate some of the stresses that you're seeing today. All right, looks like we do have a couple questions coming in. One asks about the learning curve clients will have primarily when meeting online, and what's the client experience like? Are there any resources that they can use to get adjusted? That's a great question. That's from Lily. Lily, I would say that the overwhelming feedback from the perspective of the patients, the actual participants in the telehealth sessions, is that it's very simple to join a Secure Video session. They are either invited to the session via email or by text message. From there, they click on the link that they're sent, and it's taken them to a virtual waiting room page. Now, the virtual waiting room page may be very straightforward. All it does is have a button that says enter session. Or it may include things like a payment requirement if you require a copay or some kind of payment for service in advance. Or it may have links to all of your e-documents that you need this participant to fill out. All of that, again, our understanding is very straightforward from a participant perspective. But as we always recognize, people come to Secure Video sessions from different places, technically speaking. So I would encourage you just to really think about who your client population is. Is telehealth a good fit for you and your practice? If you feel like there are going to be some challenges, I'd say let's connect, let's talk with someone in support. take a look at what that experience looks like. I think to me, it's all about the communication to your participants. If you're going to venture into telehealth and implementing some of these features, let them know what to expect. Maybe there's some resources that we can help you with in terms of our knowledge base and support articles that have just a multitude of information about what the different experiences may be, but that's all based on your setup and how you want your patients interacting with it. So I hope that helps. I just will always add, and I like to always end with this, is our support team is fantastic. And that support is not just for you as an account holder, it's for your clients or your patients as well. So they can call 24/7 to our live phone support, get an agent, usually within a minute or two, talk to somebody and really walk them through the exact question they're having. Our goal when we talk to someone in support is let's get this person into their session as quickly as possible with as little resistance. So that's what we just strive to do. And then Jacob asks, as a follow-up, does it work in other countries? Yes, it does. So Secure Video is high trust certified, HIPAA compliant. We do follow the highest security standards, and it's available on any device just through the internet. So yes, available in other countries as well. And let's see. Michelle, I just wanted to ask any follow-ups to any questions that have been asked or anything you might want to call out that we might have missed.
I've answered most of them live, although there was one regarding scheduling an interpreter. That one I answered by typing, but
Okay.
um, it was about uh, scheduling interpreter like on demand only, or if you could schedule ahead of time.
Ah,
It is on demand only, but the average wait time is about 30 seconds. Uh, might change a little depending on the time of day, but we have a timer that counts down like how long it's been. We automatically send like a new request if for some reason um, that one isn't taken. And put a link to the support article there if people want to see an example of the timers.
great. Thanks, Michelle.
Thank-
All right. Not seeing any other open questions at the moment. Oh, let's see. We got another one entered late, so I'm not sure what I missed. Will the recording and or the transcript be available for me to view? Yes, we are recording today's session and we'll be sending this out via email in a follow-up to everyone that attended today or everyone that registered and then could not attend. And we also post webinars on our website as well. So this content will be available later. Also, keep in mind, we do have some resources that we'll be sending out as a follow-up to this as well, including a survey specifically about provider burnout and some resources and tips if that's something that you're being affected by today. So yes, please look for follow-up from us, I'd say within the next couple of days. All right. Well, everybody, thank you so much for attending. Josh, I'll toss it back to you for wrap up and close.
Yeah, appreciate everybody's time today. And like I said, feel free to reach out, support at SecureVideo.com, but we'll be following up with everybody who attended today and who registered. So thanks, everybody.
Have a good day. Thank you.
Bye.